Hi and a very good morning to everyone. My name is Hamad Fidos bin Abdul Hamid and today I would like to share a story about depression and how to overcome it. Imagine waking up each morning with a heavy heart where the sun's rays struggle to pierce through the cloud of your mind. Depression is not just a word. It's a silent storm that rages within, affecting millions silently. Globally, an estimate 5% of adults suffer from depression and estimate 3.8% of population experiencing depression, including 5% of adults, 4% among men and 6% among women, and 5.7% of adults older than 60 years old. Depression is not just a feeling sad, it's a complex and often debilitating mental health condition. It can feel like a heavy cloud that refuses to lift, impacting every aspect of person's life. Although depression can come in many forms, it is advisable for us to seek help, taking self-care, plus practicing mindfulness of meditation. Let's talk about depression, not in whisper, but in symphony of understanding and compassion. First, we can seek professionals' help for a better understanding of overcoming depression. Mental health professionals are trained to help us navigate this difficult journey by offering support, therapy, and in some cases, medication. Then, by that, we can have a clear vision of understanding the depth of depression. Professionals such as psychologists, psychiatrists, and counselors are well versed in the complexities of depression. They can assist people in peeling back the layer of their emotion, belief, and behavior in order to find the underlying difficulties. Must to understand that depression isn't one size fits all illness based on the individual's unique experience. Professionals can deliver an accurate diagnosis. With this diagnosis, a personalized treatment plan may be devised, which may include therapy, medication, or a mix of the two. By that, the professional environment provides individuals with a discreet and non-judgmental area in which is communicate their sentimental without fear of stigma. This secure atmosphere promotes open conversation which build trust between the individuals and the mental health professional. Plus, they can monitor, educate, empowering individuals to take control. Remember that seeking professionals treatment is a personal decision and it is critical to choose a mental health expert that share your needs and beliefs. Breaking the silence and seeking professional help can be a game changer on a path to recovery and a brighter future. Now, you get some idea, right? Let's see what we can do next. Some people need to stand up for themselves by taking self-care to change their behavior towards depression. Taking care of yourself is crucial for maintaining a good mental and physical well-being. First, physical self-care. Exercise. Participate in regular exercise such as going gym, going on a walk, or doing yoga. Exercise provides various physical and mental health advantage. Maintaining a balanced diet that includes a range of vegetables, fruits, lean meat, and whole grain. Nutrition is critical to overall health. Second, emotional self-care. Allow yourself to feel and express the wide range of emotion. Talk to someone you trust. Maintain a diary or do something to help you process and understand your emotion. Set boundaries. Learn to say no when need and establish healthy boundaries in relationship. Prioritize your needs and well-being and socialize self-care. Connect with others, build and maintain supportive relationships. Spend time with your friends or family or community to foster a sense of connection and belonging. Limit social media. While staying connected, it's important to be mindful of the time you spend on social media. Take the breaks you need to avoid comparison and information overload. Reflect and connect. Participate in activities that are consistent with your spiritual conviction. Prayer, meditation, or spending time in nature may all help to build a feeling purpose and connection. Remember that self-care is a personal process, so figure out what works best for you. Incorporating this practice into your routine on a regular basis can lead improve general well-being and resilience in the face of life adversities. Now you have an idea to do things. Let's moving by empowering our mindset. So practice like of mindfulness meditation and cultivating resilience help us navigate the challenge life threw at us. Mindful is a practice of paying attention to the current moment without judgment. You may disrupt by the loop of ruminative thought that commonly accompany despair by the concentrating on here and now. Mindful breathing. A simple yet but powerful approach to anchor oneself to practice mindful breathing. Inhale gently, deliberately focusing on each breath. This can assist alleviate tension and anxiety. Mindful observation. Engage your sense in the here and now. Take in a surrounding sight, sound, smell, taste and sensation. This practice might help you to move your attention away from the unpleasant thought. Mindful acceptance. Acceptance is a critical component of the mindfulness. Recognize your idea and feelings without passing judgment. Rather than opposing or combating them, watch them with wonder and compassion. Next, resilience. Adapting to the recovering from adversity. In what resilience entails. Cognitive restructuring aid in the challenge that modification of the unfavorable cognitive habit. Identify and replace negative thought with an optimistic and realistic one. Develop effective problem solving skills. To tackle challenge, break down larger issue into smaller, more manageable tasks. Taking productive steps to address problem can enhance the sense of control. Resilience people frequently have a solid support network. Develop meaningful relationship with friends, family or support group. Sharing your thought and experience with others can offer emotional support and insight. Kindness and understanding should be shown to oneself. Recognize that everyone confront challenge and is normal to struggle. Self-compassion may be practiced by treating oneself as you would a friend in distress. In order to incorporate mindful and resilient into your everyday life, you must be consistent. It is best to begin with a simple, double measure and progress safely add to them. In conclusion, overcoming depression is a complicated path that takes patience, self-compassion, and a dedication to overall well-being. Each person's journey to recovery from depression is unique. Be kind with yourself, celebrate tiny victories, and recognize that growth takes time. If you or someone you know is depressed, urge them to get a professional treatment and provide a loving and supportive environment. It is possible to escape from the shadow of depression into the brighter, more hopeful future with the correct resource and dedication to good transformation. Thank you for listening. Have a nice day. Bye.